So we can go ahead. All right, good afternoon, everyone. It's like Stephen's just joining us. All right, I think our only agenda item was, actually, let me just pull that back up.
Share the agenda, Judge, if you'd like me to. The only agenda item that I generally put on for these work group meetings is topics of discussion for this meeting will include the Superior Court Pretrial Services Unit and the Risk Assessment Tool.
Okay.
That's a pretty overarching agenda item that allows you all to discuss whatever comes up.
Great, and I do see that we have Dr. Peterson with us this week, and we do have John as well from Pretrial Services. Is there anything specifically, I know we've been wanting to hear from Dr. Peterson as far as what he's analyzed thus far, if he has. So maybe we'll start there. I know we've been kind of footing that for a while.
Sure. So I've been talking to John a little bit. So I don't actually get specific like jail data or first appearance data from anybody, from Whatcom or any other counties. The only things I have are just records of charges filed as part of the AOC data. In the past, I've been able to do some analysis because Dave Reynolds was kind enough to do the very time-consuming task of kind of recording everything manually in a spreadsheet and send it to me. But I didn't expect that to continue, just like I said, because it was so time-consuming for him. Bruce also had sent me some things in the same kind of manner. So if there are specific things you want to look at, let me know and I can maybe work with John or something like that. But as of right now, I don't really have the data. I don't get regular extracts of data to look at.
Okay, thank you. Well, at this point, I know we've discussed kind of what we wanted to target previously with that data, but I don't see Judge Garrett yet on the call. So I think she had some specific ideas. I don't know if Stephen, you wanted to talk about that at all. I've voiced my concern at a few of the meetings as to what that data is going to look like during COVID and jail restrictions and everything else. And we now have more jail restrictions going on currently. So I'm still a little bit skeptical as to how we are able to kind of discern what those trends are based on the risk assessment or every other external factor that's gone on in the last 2 years. But without Judge Garrett on the phone, I'm not sure we want to go further on that topic today. Stephen, did you have anything to add?
No, Your Honor, I really don't have any thoughts about what our next steps should be. I thought Dr. Peterson was still getting data that would eventually be of some use. I understand the demands that places on Dave and Bruce. So if we pause that, is there a way to catch back up with that, or is there any other way besides the onerous personal aggregation task to, sort of fill in the gaps of the data that we have, because we're going to want to come back and look at that stuff, I think.
And Dave Reynolds, I know you and John have talked a little bit about that since our last meeting.
Yeah, the information I was getting early on is sending Dr. Peterson. I simply don't have the time to gather that information. I'm not sure what information John has related to pretrial that he can provide to him.
Sorry, I didn't know if we're video on, video off. It's always hard to tell, but the board call. But yeah, so it really depends on what you want to know. If you're just talking, if you just want to look at people on supervision, then maybe that's something I can get from John. If you want to look at everybody that comes before the court on a first appearance, then we'd have to find another means, just because John will have all of those individuals. So I think it comes down to deciding what you want to know first, and then we can go from there and find a way.
And that was the piece that I kind of wanted to have Judge Garrett talk about a little bit, because I think she had identified some pieces that she wanted to look at previously. This is going back a couple of meetings at least, but I think that's going to have to be our starting point, and then see how we gather that information. And I can work with Dave and John on that, see how, if that's possible. Part of it, I'm just wondering, Dave, is, it's not going to resolve what we have to analyze over the last couple of years, but I mean, is this something that we need to change our kind of data collection when we're processing to begin with? So we're tracking certain things that we're not now.
Probably. When I was doing the tracking before, it was for everybody coming before the court. It was before we had a pretrial unit on things. I'm thinking John probably has access to historical information on people who have been on pretrial. I think that's what Judge Garrett was getting at.
Yeah,
Simply just focusing on the people assigned to pretrial.
yeah, that was my recollection as well. But
that does narrow it down, and I would think John would have access to some of that. We can identify for Dr. Peterson what exactly he needs.
And also, if it'd be helpful, I know there's the National Institute of Corrections, I believe it is, which was part of the Bureau of Prisons, or maybe Department of Justice, came out with a document. I think they recently redid it, maybe last summer. And it's kind of a bunch of suggested measures on things that you at least want to consider looking at in the pretrial process. And so, different elements, everything from caseloads per staff to success or failure rates, or that kind of thing. So I can send that along, dig that up, and if I send that along, that might be helpful.
yeah, that'd be great.
Sure.
Could I just say, in terms of the data that we want, just historically, we started these discussions when Vera Institute told us 60% of the people in jail were pretrial, and Superior Court had only bail to use. So we thought there were economic disparities in that. So we're trying to reduce the pretrial incarceration rate. So it seems like we want to know everybody that's coming in to that continuum. We want to know how many people are being released. We want to know why, and we want to be able to assess the racial breakdown of that group as well. So we want to see if the adoption of a pretrial risk assessment tool is reducing pretrial incarceration, producing it in an equitable or even a more equitable way, and it's not reliant on economic disparities for who's in and who's out. That seems like a pretty straightforward approach. I can't remember, Judge Freeman, what Judge Garrett's list of focuses were. They're probably more extensive than that, but that seems like the core of it. And Maya, I don't know what your perspective would be on those questions.
They're good questions. They're good questions. I think you talked about like whether, yeah, I think seeing the racial impact would be interesting and see if there's unintended impacts of like who's getting who's getting the pretrial conditions on top of bail. Yeah, I don't really have anything to add in terms of collecting data at this point.
Yeah, that was one piece we discussed previously, was the, who's getting pretrials, some sort of level of pretrial supervision with bail versus simply a PR with pretrial services. And that was one factor I don't think we were tracking. And that's kind of what I was alluding to, is an element that we might need to start tracking if we haven't so far. Otherwise, that's going to be a lot of data that's going to have to be gathered. And, I will just say as a brief practical update that, and Maya can speak to this too, I'm sure, but, with the changing landscape of the jail situation in the last few months, it's been difficult to, I'm not going to say implement. I think all of our judicial officers are using the risk assessment as a tool, but at the same time, they're having to kind of change their approach on what feels like a weekly basis lately, as to jail booking restrictions and to numbers over there. I don't know who all was on the conference yesterday, but Wendy Jones presented numbers as far as our current population, and I think it was more like 80% now pretrial felony population. I want to say it was 82-83%, somewhere in there. So obviously those numbers, and I don't know whether I don't think we can totally isolate it to what's going on with COVID and the jail situation, but certainly our pretrial felony population has expanded. And I can tell you what I see I think Wendy sends it to the judges once or twice a month, the aging population. We're also looking at a lot older cases. And that, yeah, is significant when we're considering, at least I think when the commissioners are considering bail at first appearance right now, because we do have a lot of folks in there on relatively serious charges that have been there for quite a while right now. I've forgotten from our last meeting, Stephen, did we follow up after we had an informal meeting with Dr. Johnson, and did we ever follow up with that?
No, I don't think we did. I think we just told them when we were ready to go, we'd loop them back in.
Okay.
That's my recollection, at least.
Okay. And what I've formally told Dr. Johnson is that we probably wouldn't be doing that until we had more concrete either numbers to analyze or a better idea of what we were trying to, look at as far as primarily the racial impacts.
But was this the community sort of input group or something like that? Yeah. Okay. And I know that it was Adam Fryer from LEAD and Dr. Johnson, formerly from Western. Was there somebody else? Do we have is there someone who's impacted, personally impacted person that could be included? It seems like that would be an appropriate addition to the group.
It would be a great addition to the.
I don't think either of them, thankfully, are first,
I think our thinking was, that Adam interacts with that population on a daily basis, and he'd be sort of an intermediary. But
That makes sense.
And they both, and I think we reported this at the last meeting, but they both seemed very open to assisting. So.
So what's next? Where are we? Sorry. I feel a
I had
little-
no,
Yeah.
like we're looking for more, we need more data. We're not sure we're collecting the right data.
From my perspective, there are two things. One is the data side of it, and yes, identifying what we need to collect and what we're targeting as far as analysis. And I think that's a discussion that we need to continue to have. And I know Judge Garrett had some particular ideas on that, and I'd like to consult with her on it. The other aspect that's been an ongoing discussion that I do think is worthy of continuing is, what our pretrial services department looks like, and if there are other areas that could be of assistance in order to either get people into court without bail, things that will reduce the pretrial population in the jail that we could benefit. And I know we've heard from district court on that a little bit, but I think, from the judge's perspective, I think we're still open to other ideas and what that would look like and changes to our pretrial department.
John, are you referring folks to lead as in your role as pretrial supervisor?
Am I what? What are you
Ye-
asking?
Do you ever refer folks to the lead program?
Probably been quite a while. If they come here and they need something, we refer them to any appropriate services. Our main goal is court reminders and,
Right.
new law violations. But yeah, we do if there's a concern there.
And Maya, and I'm sorry for my ignorance on this one a little bit, but your office employs a social worker as well that works with outreach and services.
We do. We have 2 behavioral health specialists now who do that kind of work. Yeah.
I mean, is there anything from your perspective when it comes to the work that's being done with your behavioral health specialists from what either could be as far as either referrals or things of that nature coming directly from court services as well? Are there any gaps in that?
I mean, I'm sure, I just think we use our behavioral health specialists for mitigation reports and for collecting records and getting people into mental health court and other therapeutic courts. I mean, they're pretty slammed. Frankly, I just met with them for an update before this, and they're working at capacity. But I just think of pretrial services contact as a point of contact with clients or defendants who are in the community who it's an opportunity. It's a contact opportunity. And it's could there be more done at that point of contact to give them services, to link them with services? I know that's not really the job of pretrial services. It's more pretrial tracking, but it just seems like if there's a mandatory contact, it could be utilized better, maybe. I know that's not really the mission. I don't know. I mean, we could make it, can we make it the mission to make it more meaningful? I don't know. Just brainstorming.
Your Honor, Carol had a question, I think.
Yeah, go ahead, Carol. Thank you, Stephen.
Just back on the indicators and what's measurable question. I'm just wondering if there's anything we can learn from any work happening in other areas. I know our jail certainly has some unique challenges just with the facility itself, but everyone's dealing with COVID. So there must be other jurisdictions that are trying to measure how their reform efforts are doing in the context of changing pressures that are so much bigger and different than that. So I'm wondering, Dr. Peterson, are you aware of any any work to identify indicators that are still meaningful, that could somehow give us some information, even though these other pressures are really dwarfing some of the work that's trying to be done?
Sure, and I think it's a tough question right now, just because, there are a lot of forces, as you all well know. I mean, it's, not only just jail admissions, but, prosecutors the cases might be lingering longer. Police are not bringing all the cases that they were because they're more reactive than proactive, I've heard anecdotally. So things are just going to look very different right now. However, both Pierce and Thurston counties are in the middle of implementation of the PSA as well. So they have this 5-year grant through Arnold Ventures to implement the PSA, and they just finished the validations in each county for that. So basically took their old, the old jail data where you already knew the outcomes of the cases, and said, okay, based on these couple years of data, thousands of people that had gone through the jail at that point, who were the groups that went through, finished their cases without any FTAs, without new criminal offenses, and especially without new violent criminal offenses, and said, how would we have scored those individuals coming in, and did those numbers match up well to what we'd expected? And for the most part, it did. So I know they did that very recently. They just presented, I want to say the end of last year, so October, November-ish, December, that time. So that's happening, and they're also still kind of figuring out with their case management systems what they can measure and what they need to measure. And so I've been able to sit in on some of those, and they're kind of just going through that same document I mentioned, measuring it. I think it's called Measuring What Matters or Measuring What Counts, something like that. And seeing what they can get and what is important to their jurisdiction.
Dr. Peterson, I guess I was thinking very much along the same lines Carol suggested. Is it possible for us to get copies of the Pearson Snohomish validation studies?
So it's Pearson Thurston, and I'll reach out to them and ask. Yeah,
Okay.
I'll see if they're willing to share.
And is it possible for you to, again, I don't want to make this labor intensive, but is it possible for you to compile a list of what data we ought to be looking at? Or, I mean, one of the advantages of the PSA is that outside Washington, it had been implemented, it had been studied post-implementation. So what data are those jurisdictions looking for? And then we can compare that to what data we have or don't have.
Sure.
Is it possible to get some of that background perspective from you?
Yeah, absolutely. Yeah, so let me do some kind of digging through emails and files and things and put something together. The part of this process with Pearson Thurston was they had kind of outside consultants work with them and say, okay, here's a list of potential items that came from this document. Prioritize these 1 through whatever it was. And then let's map out, where this data would come from, so that we understand that, and then we can see, is it feasible still? And so then you can make a list going from that. Once is it important, and if we can get it. So what I can do is see if I can find that original list and maybe send that to the group. And I don't know if you guys want to do go through that same kind of process of, everybody kind of votes whatever they think is important. And then we see, based on that list, what's possible.
I say yes.
Sounds good. All right, I'll work through Jill then, and I'll send her the list to distribute out.
Thank you.
And you've sat in on some of the Thurston and Pierre. Are they set up similar to us as far as a work group dynamic, or is it coming directly through Superior Court?
Let me think. So they're a bigger work group. so they, I didn't organize the work group, obviously. I was just there to kind of inform on like what's available statewide and that kind of thing. But they have representatives from defense, from the prosecutor's office. So I think in each case, the head prosecutor is there. The head of the public defense is there. They have police chiefs and the sheriffs, and the sheriff is there as well, the county sheriff. They have county representatives in terms of, budget, public safety, communications, so that all those areas are covered. And messages getting out to people that need to know, kind of thing. Pretrial services is there. They have at least a couple judges there at all times, one from district and municipal and one from Superior Court.
Okay.
Yeah.
Thank you.
So yeah, it's a bigger group. And again, part of it's because it's grant funded, right? It's not all just an interest thing.
So I did want to turn to John for a moment as well and see if he had any updates as far as how things are going, what the numbers currently are with pretrial services, unless we have anything further on that topic as far as the data collection.
Yeah, well, I got, well, I'll just give you our numbers. Currently at 127 and 71 on, and then we got different levels of 3 levels. 71 are at medium, 38 are on low, and 15 are on high. And then I did go through and check. 6% of those are incarcerated with bail. So, and 6 of those are medium and 2 are high. So approximately 8 out of the 127.
Okay.
Anything else?
Yeah, John, how many are PR'd?
I don't have that number.
I'm thinking, it seems like that population that are PR'd, but given pretrial release conditions, would be a really good population to send as refer them to LEAD. And I'm on the operational work group for LEAD, and like we get referrals from everywhere, like jail, prosecutors, public defense, wherever. And if those folks were like a list was generated each week or every other week and sent over to LEAD, here's the folks that are PR'd and on pretrial conditions, that seems like the population LEAD's trying to work with, frequent contacts or contacts with law enforcement and potentially in need of services. And they could be like screened and talked about. That might be a way to kind of tap into linking services with pretrial release and making it more meaningful. But if you're not tracking, I mean, we need to track. I think that's the piece I've talked about missing. Like we need to know what is the bail and what are the pretrial release conditions? What are both of those things?
Yeah.
Maya, can I ask a question? Why would you specifically be more concerned about making that LEAD referral with people who are PR'd versus people where bail is set and posted and they're out with some conditions?
I don't, it could be either. I guess it kind of, without knowing the numbers, it's hard. I mean, it sounds like there's 127 people right now. That's a lot. And, a way to kind of just winnow like first wave. And maybe it should be the opposite. Maybe it should be those that had a money bail and pretrial conditions because they're maybe in need of higher services. I don't know exactly, but without knowing, I can't imagine dumping 170. So the LEAD would be like, that's a terrible idea. Don't do that to us, Maya. If we try to dump 127, if we try to send them 10 or something, maybe we could do that. Or start a stream, like if John was able to send a report here, these 10 people, these 5 people got pretrial services in the last 2 weeks. Let's see if they're LEAD appropriate to see if we can try to do something with them. I don't know.
Can I just comment on our mindset here? Because there have been a couple of comments about what data is feasible or how many people pretrial services could manage or how many people lead case managers could handle. And that's valuable to know, but we're also trying to identify what we really would ideally like to do. And if we don't have the capacity to do that, or we don't have the data systems to gather that information, that's just as valuable for us to know. There's a lot of money floating around right now. There's the council's stakeholder advisory commission working on a ballot initiative to fund a new jail and a package of surrounding services. So I would ask us both to know what's feasible now, but also what we really ideally would like to have, because maybe we need more lead case managers, or maybe John needs a fuller staff, or maybe we need more robust data software within the agencies in the continuum of services. And at least from the task force perspective, I'd like to know that so that we can see if those are reasonable asks to make, or we can make persuasive cases for expanding what our capabilities are.
Any other questions for John as far as what our current status is?
I guess I'd like to hear from John, like, what do you think could be meaningful and could make your program more robust? And I don't know, like, what's your vision?
I think the data gathering is important to see. Just a lot of emphasis has been put on the assessment tool and how that can be meaningful and useful. It is valuable to use some sort of objective assessment. From that, the data on bail reform, pretrial services instead of bail, all those things could be looked at through the data. And jail population can be impacted by releasing certain defendants to pretrial services more consistently, if the council and others think about that, different kind of crimes, nonviolent, those kind of things. And a streamlined referral system would be good, like the lead, like you're saying, if we could tap into a streamlined system with weekly names and people and contact information, and that would be good. We would offer it here in the office, just recommend it. Wouldn't, of course, be a requirement, but it'd be a recommendation. If you got needs here, you got, from housing to substance abuse or job, all kinds of things going on right now, getting your license, ID, all those. But yeah, having a referral system, probably the data will be a while. That's going to take a while to collect, but it's extremely valuable. Referral system, we can streamline some of that, and we have been doing a bit, but I could do it more. And that could be something very present, but that really wouldn't have to fall on numbers. You just kind of give me an idea who would be appropriate, or we just kind of screen them in the office if they're, if they live local or not, or if they do have needs, or those kind of things.
It just seems to me that if the goal is truly incarceration reduction pretrial, then the first step was the PSA and trying to filter out who we can through that tool, partly using that tool. But the second step is, making it that pretrial services actually impacts folks from coming back into the system, being back there on pretrial release reviews and being booked back in on bail. And I think that's a huge step, would be having those referrals. And, that to me, that makes sense as to why that would actually have a direct impact on avoiding that review. So
Maybe we could invite lead, I don't know when is our next meeting, but it'd be cool to invite Tommy, Melora, whoever from lead, and say, look, is this a stream that you could accept? And are you interested? I can email them that this idea came up, but.
yeah, I would love to hear from them at a meeting.
Does somebody, like, I can do it. I go to their meetings a lot, unless I don't know if there's like somebody who has that job of organizing these meetings that would prefer to take that on. When do we meet next? Can someone tell me that, and then I could.
Well, good news, Maya, that is my job. Our next meeting is April 20th at noon. And if you could just shoot me the names of those staff and their contact information, I
Yeah,
can definitely issue a formal invitation to them.
Very cool. I will send you their emails right now. Thanks, Jill.
All right. Any other topics that we want to discuss today? Okay, so I think the two items that we need to focus on for our next meeting are going to be identifying, as far as our data collection, what we're actually targeting, and therefore what we need to do as far as either analysis or collection. And second, that we plan for the next meeting to involve the LEAD program and hopefully heavily involve John as well, so that we can kind of talk about what that would look like if we started a more formal referral system out of pretrial services.
And then Dr. Peterson, you're going to circulate the Pearson Thurston validation studies?
I'm going to see, yeah, if those are available to be shared. Yeah, and if so, absolutely share them. Also, you mentioned outside of Washington, the PSA has been implemented, but it's been implemented in Yakima County now for a few years.
Right.
They've been using it, so they might be another resource if you know anybody there. If not, I can maybe get some names.
And I've got a few connections in Thurston. I'm happy to reach out directly to Superior Court down there, just to talk to them about it. I just will have to identify who is actually involved in that.
So Judge Schaller is on the group, as is Judge Price, who's now going to be going up to the Court of Appeals. So yeah, either one of those would be good. And Marianne Clear is their pretrial person, and she'd also be a good contact.
They also oversee district court pretrial services, don't they? It's a mixed department.
I thought it was separate, but maybe I'm mistaken now.
I think they have pretrial for both district and superior.
Okay, it's very possible. Yeah, can't say 100%, so certainly right now.
And Dr. Peterson, I think it's been a while since we've had any contact with Yakima. So if you could vacuum up any information from there that you have contacts for, that would be probably the most efficient way.
Sure, absolutely.
All right, anything further? Then I will turn to Jill and see if we have any public comment.
There are no attendees and no public comment today.
Okay. Well, thank you, everybody, and I'll see you at our next meeting.
Thanks, everyone.
Yeah.